The emergency department at Virginia Mason is staffed by highly experienced, board-certified emergency physicians and certified emergency nurses. Our teams are ready to treat all types of emergencies 24/7, including and not limited to thrombectomy and TPA for stroke, neurosurgical services, cardiac catheterization for STEMI, care for VFib arrest, sepsis, GI bleeds, oncology, respiratory failure, and pulmonary embolism. With the pre-arrival call from a Medic 1 doctor, the use of the Pulsera application alerts the stroke team prior to patient arrival. Assignment of the ER physician and primary nurse, as well as the ordering of essential tests such as a CT scan, are done prior to the patient arrival. Due to pre-arrival call and activation of stroke team via Pulsera, all members are ready and available prior to the patient arriving. All LAMS 4 or 5 score patients will activate our IR team, which includes neurointerventionalists, anesthesiologists, IRRN, and IR tech. While all LAMS 4 or 5 patients will not necessarily result in thrombectomy, the IR team is absolutely ready to ensure the highest level of care. After code stroke activation, when medics arrive with a patient, they will be greeted by at least 2 ED-RNs, 1 ED tech, an ED provider, a neurohospitalist, a pharmacist for possible TPA administration, an IRRN for possible transfer to IR for thrombectomy, an anesthesiologist for possible difficult airway during IR procedure of high LAM score, as well as a CT tech ready to transfer patient onto the CT table for first images. We have designed our IR suite and cath lab in close proximity to the ED to expedite transfer of patients from the ED to these locations, for as we know, time is brain and time is muscle. The focus at Virginia Mason is streamlined throughput, no wait, and clear handoff. When Medic 1 brings a patient into our rooms, you will be greeted by at least 2 RNs, an ED tech, an ED provider for efficient handoff. Our ED may not look like the largest ED. That is because we expedite patients out of the ED and into our ICU as quickly as possible.